Hello everyone, my name is Kristen Lovelace, and this presentation is going to be about the comparison between the teach-back method of patient education compared to the verbal patient education. The topic that was chosen for this presentation is providing patient education to help decrease hospital readmission rates. The connection to this topic is it is our job as nurses to provide the most optimal patient education to help the patient understand their diagnosis and to help the patient understand any new lifestyle modifications that they may need to make in order to improve their life. So the clinical question is, in middle-aged adults, how does the teach-back method of patient education compared with verbal patient education affect the decreased rates of patient readmission within the time of discharge? There are two main reasons for justification. The first reason being that according to a study that was done by the Journal of Patient Safety, using the teach-back method of patient education decreased the 30-day readmission rates by 45%. However, the study that is included only involves 5 patient case studies. The second reason for justification is a study performed by the Journal of Cardiovascular Nursing shows that telephone-delivered patient education was not effective in improving health behaviors in the patients involved in this study. Telephone-delivered patient education is also known as verbal patient education. The evidence-based practice model that was chosen for this presentation is called the Staedtler Model. There are 5 phases involved in this model. The first phase being preparation, second phase being validation, third phase being evaluation and decision-making, the fourth phase being translation and application, and the fifth phase being the evaluation phase. This Staedtler model was chosen for this presentation due to the evaluation phase. The key stakeholder for this scenario would be what's called the healthcare consumer. But before we go over that, let's go over what a stakeholder actually is. A stakeholder is a healthcare provider, a policymaker, healthcare consumers such as patients, and others as well. The key stakeholder in this instance would be the healthcare consumer, mainly because the healthcare consumer would actually be receiving the patient education that we are comparing. This presentation includes evidence based off of 3 articles, the first article being a systemic review. The purpose of the first article is to identify the effectiveness of discharge education using the teach-back method on 30-day readmission rates. The sample size and characteristics of this article include 3 studies on heart failure, 1 study on a total joint replacement, and 1 study on a CABG. The methods that were used in this article involved 2 trained reviewers performed by a critical appraisal of retrieved studies using the risk of bias assessment tool for non-randomized studies. Data were collected, analyzed using the Cochrane Review Manager software. The findings from this article state that the results that discharge education with the teach-back method resulted in a 45% reduction in the 30-day readmission rates. The second article is called a randomized control trial. The purpose of this article is to test the effectiveness of a health belief model comprehensive reminder system on health behaviors and blood pressure control in hypertensive and ischemic stroke patients. The sample size and characteristics of this article include 174 hospitalized hypertensive ischemic stroke patients. The methods involved in this article are interventions that involve face-to-face and telephone health belief education, a patient calendar handbook, and a weekly automated short messaging service. Data was collected at baseline as well as 3 months post-discharge. The findings from this article indicate that at 3 months, the use of the comprehensive reminder system based on the health belief model yielded improvements in most health behaviors and blood pressure control in the hypertensive and ischemic stroke patients. In the third article, it is a pilot study, which is also known as an original study. The purpose of this original study is to examine the effects of a multimedia patient education intervention on improving self-care knowledge and skills in patients with colorectal cancer who had colostomy surgery. The sample size and characteristics of this article involve 63 patients who have colorectal cancer and have undergone colostomy surgeries and were then separated into 2 groups. The experimental group of 33 patients received multimedia patient education intervention and a control group of 30 patients who received conventional instructions. Results were evaluated by using analysis of covariance. The findings from this article indicate that the multimedia patient education yielded a greater improvement in self-care knowledge and skills than the conventional instructions. Now, in these three articles, we are going to identify two patterns as well as one strength and one limitation. One pattern being that all of these articles involve some sort of quantitative investigation. For example, the first article involves 5 patient case studies. The second article involves 174 hospitalized hypertensive ischemic stroke patients. And the third involves 63 patients who have colorectal cancer and have undergone colostomy surgeries. The second pattern being that all articles seem to be in favor of a patient education method that involves a physical demonstration of the teaching. The strength that is seen as in Article 1 shows a specific percentage of improvement in the 30-day readmission rate. The reason why this is considered a strength is because this percentage shows a measurable amount of improvement rather than just stating that there was an improvement. One limitation that can be seen in Article 1 as well is the small sample size. The reason why the small sample size is considered a limitation is because a small sample size has the potential to decrease the statistical power and the ability to identify significant clinical findings. There are two main recommendations that can be made. Recommendation 1 being to perform a similar study to Article 1 but include a larger sample size. While Article 1 shows a decrease in the 30-day readmission rates using the teach-back method, it only uses 5 patient case scenarios. When not enough participants are included in the study, the statistical power and ability to detect significant findings may decrease. The second recommendation being that in Article 2, if only verbal patient education tools are offered, offer to do a visual demonstration of the verbal patient education provided. It will decrease the rate of said patient being readmitted to the hospital for the reason for the initial visit. In conclusion, further investigation should be performed to compare the teach-back method and the verbal patient education method, mainly due to the lack of participants in the first article mentioned. The Staedtler model of evidence-based practice is a good model to help further research to the comparison between the teach-back method and verbal method of patient education, because this method allows for the comparison to occur due to the evaluation phase.